Hello, I am so excited to bring you something new that is the Women's Health series that I'll be airing here on the podcast over the next couple of weeks. I know this podcast and normally what I coach on is all on nutrition and lifting weights for ladies who want to build muscle and decrease body fat and really look the part and feel the part. But there's so much that goes into that. I know we also talk about blood work and a lot of coaching and systemizing your life, not only on the podcast, but in my program, Create Your Shape, where I work with all of my ladies. However, I want to take this time to expand on all of that and bring in experts from pelvic floor health to astrology and herbs and HRT, infertility, and running $1 million business. So I'm excited to share these conversations I've had with all of these different ladies. They have been so valuable and really discussed through the lens of wanting to be that fit, strong, healthy female who has it all in all aspects of her life. And I know for many of you, that is what we're all after. So let's get into it. Hello, friends. Welcome back to the Create Your Shape podcast. Today, I have Jazmin Lopez on, and she is going to talk. You know what? I'm just going to let her explain it because we were just talking about how it is something like so special, but also maybe difficult to explain, but she can do that for us. But Jazmin is in the women's health coach world, and she and I went to college together, so we go way back, and we have lived, I feel like, so many lives between the two of us, between all of our adventures and everything that we've gotten into. So it's cool to have this kind of full circle moment from partying together in college to like putting our work out in the world. But I'm excited for you to add to the series and kind of bring a different kind of something that I haven't gotten into very much in my world. But Jazmin, can you introduce yourself and tell us what you do?
Yes, absolutely. So, yeah, I'm really happy to be here. Thanks, Jenny. And it's really cool to reconnect with you and see you in this different life, see us in this different life, and the way that life has taken us down these really amazing paths, and that we've both ended up in this world of working with women and working on our own health and going on our own journeys. So, yeah, I'm really thankful to be here with you. And so let's see a little bit about me. So I am what I would say, a women's natural health practitioner. My background is as first and originally a physical therapist. So I'm a physical therapist. I work with women on a variety of physical therapy type things, but it's mostly based on pelvic floor therapy and abdominal therapy. That work kind of developed in my practice with women to start to incorporate herbalism. And so I work as both a physical therapist and herbalist. And then lastly, I'm also a medical astrologer, which we'll talk a little bit about, but is really intertwined actually with herbal practice and herbal medicine. And so my practice with women kind of fuses all these different realms, from bodywork to herbal medicines to energetic types of work and healing, to kind of give a full spectrum and holistic approach to women's health concerns and issues. Yeah.
Yeah, love it. So I actually, in the Women's Health series, we also have someone who came on as a pelvic health specialist in the spirit of women's health. But it's cool because she said that she first got into physical therapy, and this was a really long time ago, and there was no really like help for this area. And so then just through like women coming in and kind of like sharing and complaining with their symptoms, she was like, oh, there's a need here, and then went down that path, which I'm
Right.
wondering if you had somewhat of a similar path but kind of took it a little further, where you realized that, oh, there's a need here, but then also, wait a minute, there's a need that's deeper than just the muscles and the tissues that and brought you more into being an herbalist and like an astrologist and all of that. But I'm curious, what's kind of your path to this point?
Yeah, so it was kind of a combination of things like that. So, one, it was the practice, and the clients and women that were coming to see me were often, it's really interesting. often asking me just naturally through our work together, sort of deeper questions or like deeper concerns. And it became really apparent to me this like limited knowledge or framework that I'd been given through my physical therapy training that just wasn't touching on so many things that seemed relevant to what was going on. Like there were so many women, right, where it's like, how am I not going to talk to these women about food or nutrition or what's going on emotionally or what's going on in their lives energetically that's feeding kind of into some of this presentation, right? And I think most pelvic floor physical therapists have probably also had the experience of when you're working with women in such an intimate space, there's so much more that comes up that is beyond just this physical issue, this physical presentation. Yep, you're fixed, you're good, out the door, right? And so it became very apparent to me that something was really missing in the what I had learned and how I was approaching and the framework we're kind of given in the Western medical system. And so it sort of sent me on this, path. Basically, I was following the questions that women were asking me, and it sort of guided me and kept guiding me. And then, of course, there's always the other aspect where my own personal health journey kind of intertwined with that, where in the midst of a lot of these changes that I was going through in my career and the way that I was wanting to practice and work with women was changing and getting really uproot, right? So life was getting really uprooted. And then personally, I was going through a lot of health changes and issues. I had a really intense thyroid crisis at this period of time in my life, and it took a really, really long time to figure out that it was my thyroid, right? And so, that experience, my own life, and navigating the medical system for my own health issues and the options that I was given and the way that I really had to figure things out for myself and press and press and press to just get a simple diagnosis like, hey, your thyroid, my thyroid's so bad, you're almost in a coma, like, right? And so that was really eye-opening for me and kind of I had to learn and advocate for myself and also figure out like, well, how am I gonna treat myself? Because these are the options I've been given. Now that this issue has become apparent, well, now there's only also one option I'm being offered to help solve it. And so, that was that path. And then, of course, you're familiar that I also have three little sisters. And so they are also very important guides in my life and my work, and going through seeing kind of the things that women go through in their lives and as they transition at these different points in womanhood, and wanting different options for myself, wanting different options for my sisters as they started to move into the time of their life where they were going to be having children as well. All of these things kind of merged together and created this pathway for me that has turned into the practice that I have now today.
I think so many listening have maybe had a similar experience. I know I definitely have with my own health issues. And then I've seen it so many times with all the ladies that I've worked with, which actually led me to start tinkering more and being like, oh, I want to learn more about this for myself and for my ladies. Oh, I want to get blood work done. Oh, I want to take this course, this training. And now I have all of my ladies get blood work done because, kind of like you've said, when you work with women, like you realize that there's so much deeper than just like this muscle or this tissue or this goal. Like you really have to think about it from like a holistic perspective, and then all of the other things that go into that too. So I would think for maybe, let's say 75% of my listeners, they probably have heard of kind of alternative, like alternative medicine, we'll call it. But maybe half of them have heard of like functional medicine, which I feel like that's kind of what I've studied through my journey and started to apply, but I feel like there's so much more that I haven't really even like dabbled in, but I just kind of see. And I definitely see it in your work. Like I think the crossover for us is I use a ton of what may not be, all be specific herbs, but maybe herbs or adaptogens or things like that, right? That there's so much science behind all of this, but I feel like it's also kind of new, or people either aren't familiar with it because of course most of the world just wants a quick fix, or the system is set up to just give you a medication, which now people are realizing like, wait, that's not what I want. And so how would you describe your world? And I think as an herbalist, right, I know you do so much more than that, but because I follow along on social media, right, I'm thinking about what you constantly are sharing about. So that's kind of where my mind goes. But and then I'm familiar-ish with that world, but not nearly to the level that you are. And then in astrology, I feel like is something that I hear a lot, especially being in Bali, right? I hear it a lot more. But between that world, some people may say it's like woo, right? Which I don't know how we feel about that word. I kind of like the word because I'm like, oh, okay, I know what that means now. I get it. I'm kind of into it, but give me a little bit more.
Yeah.
But how would you describe it to the listeners who are kind of like, "Ooh, I'm interested in this world, but I don't really like, is it?" I have a feeling people are in their mind. I'm like, wait, is it snake oil? Is it kind of just like magic, right? Or is there science to it? Or like, where do I begin? What does it actually mean? Like, do you have a way to kind of explain that, or like kind of bridge the gap for the people who kind of like we talked about earlier that are like, oh, I sense something there. Like I want to like know more about this, but I don't know how to wrap my head around it.
Right. Yeah. And so, there's definitely a lot there because I think the idea of snake oil and deception and being unsure if like, is this like a gimmick or is this real, right? This is a deep fear for just, I think, humans in general, and it's also a big issue in our lifetime, this lifetime as well, with all of the, social media and AI, and is what I'm being shown real? Is this right? Am I being deceived? And so I think it's important I think it's natural to have those concerns, right? And as humans, we've all had probably that experience, unfortunately, of feeling like I was deceived or I was betrayed, whether that comes from a natural medicine practitioner, an energy worker, or even from a medical doctor, right? At this point, from the news, whatever, all of these different aspects of life, I think we've all probably had the experience of feeling like, I feel like I got gypped or deceived or pulled into something that wasn't exactly true. And so, I think it is important as we navigate this time and as we're looking into alternatives and other options and options beyond just what our current medical system can offer us, that it's really important to have our spidey senses on, right? Our intuition on, and to also feel really confident and have trust and faith in our own decision making. And so I often tell women, the way to avoid deception, one, is to always, to assess in yourself, like, am I desperate for something or am I devoted to my body, right? Am I desperate for a cure, for somebody to just give me the answer, for somebody to fix me, right? Or am I devoted to my body, to my health as a woman? I'm looking for guides, companions, consultants, resources to help me along this path, right? Because when we're in desperation, it opens us up to being targets of people who deceive. And so, I always tell people as well, like, look into your practitioners, right? It's like, do they actually have a practice? Because this is a issue that I see a lot. It's like there's a lot of people teaching on social media. They teach a lot, but they may not actually have a practice or be a practitioner where they're working with people and getting the experience of, right, things are not black and white. There are miracles that can happen, but there are no miracle drugs. There are no miracle herbs. There are no miracle um, substances that are outside of yourself that someone can suddenly give you, right? So miracles can happen. I do believe that, but they are just that, right? They're miracles. And so we want to be always have our senses up. Is somebody selling me a miracle, or am I, right? Is this person realistic? And this is the same for astrologers or energies worker, is someone going to tell me my future? And people reflect that too. Like they're like, are you going to tell me something bad is gonna happen to me? Or they're concerned about that. And so I'll kind of tell you a little bit about medical astrology and kind of the differences there. But I just want to encourage like listeners, if they're kind of moving into alternative spaces or options, right, to just, do your homework, look at your practitioners. Do you relate to them? Do you have a resonance with them? What is the language they use when they talk to you? Do you feel safe with them? Do they have an actual practice and experience? Who were their teachers, right? Who did they learn from? And these are all things that can help you to choose practitioners that align with you, which may be very different from what aligns to with someone else, right? Once you're getting into alternative spaces, we can go lots of different ways.
Yeah, that's really helpful. And too, I think a lot of people now within the Western medical system, I do think there are some pros for sure, but I think
Yeah,
more and more and more people their spidey senses are going off of being like,
yeah,
wait a minute, that doesn't make sense. That's not helping. What they told me doesn't like make sense. The whole setup doesn't make sense. And so I think that's why people are leaning more into like, what are my alternatives and what's more like root cause based, or what else can I look into? So that's really helpful too, of how to like navigate that. So what are typical issues that you work with? Like speaking of being a practitioner, like what are typical issues that you work with? And as I was, kind of outlining this, I noticed myself kept saying like, what issues or what problems are you solving? But I imagine too, I'm like, I don't know the word for it, but I imagine too, there's like not problems that need to be solved that people look into. I just didn't know
yeah.
how, like what that was. So I was like, okay, enlighten us. What do you work with your clients on? What are like typical things that you see that you can share with us?
Yeah, of course. And so, yes, that's something that's really important actually, and is a really important part of my own practice, and kind of switching frameworks from what I learned in school or, Western medicine, and the words and the terms that we use are very, very important. And so that's kind of been a journey for me, is kind of switching the language that I use. And I think, so it's been in my practice, I aim to see the woman in front of me as already whole, right? That this woman is not broken. She doesn't need me to fix her, right? She doesn't need me to do anything like that, because she's not broken, right? There's a woman in front of me who has her body is showing a specific set of concerns, right? Or something has happened that has taken her down a healing journey, and she needs guidance and help and wants someone on her team to navigate this health project. And so I try to use that terminology
Health
a lot.
project. I like that.
Yeah, like I am a woman with a breast project, right? I have a menstrual project. I have a hormonal project. I have a pelvic floor project, right? And so even changing that terminology as like, you're not broken, you're not this diagnosis, right? You have this set of patterns and symptoms that has shown up. What is your body, asking for? What is your body telling you? What is the direction life is taking you? What is this journey you're on like really about, because it's so much bigger than this, like, you're broken, here's a fix, right? Like our bodies are so much more intelligent than that, and there's usually so much more going on. And so even just talking to women in that way and meeting women as whole and not broken, and helping them, being a teammate with them or a guide or a resource for them as they move through this project, you just see that people's bodies like settle, right? Like the body feels relieved. Like I'm not completely screwed, right? I'm not this like that it's not all doom and gloom. Like I'm on a journey and I have resources and I have options, right? And so I would say, in a like literally, what do most women come to see me for? So my day can vary really wildly, right? Because of the work, the different options that I offer, right? And that's usually the description. So it's like, what do you do? And like, I offer options, right? Options beyond what we're typically told are our only options for treatment or working with these health projects. And so women come to see me. I would say the majority is probably hormonal, menstrual related. So that can be across the lifespan, either hormonal and menstrual concerns or projects. Early in womanhood, postpartum is a big time where I work with women and helping nourish women and helping them recover. And then menopause, of course, perimenopause. I have quite a few women who come to see me during that time. Pelvic floor concerns, of course, because of the therapy background. So bowel, bladder concerns or imbalances, pelvic floor issues, sex concerns, anything from like UTIs, chronic yeast infections, thyroid concerns, of course, digestive complaints. So it can kind of span
Yes, every woman's health.
women.
Yes,
Right?
women's
Like,
health.
what is
Okay.
women's health? It's like,
Yeah.
it's so like once you start teasing apart, it's like, wow, women really have this very special set of concerns that revolve around these three, very big life changes that we will all go through as women, right? The start of our menstrual cycle, um, motherhood, and that means, being in the mothering time of your life, whether you actually have children or maybe you're birthing a business or whatever it is you're doing, that time of life of motherhood. And then the third period of life of menopause, which we will all go through as women. And we need resources, right? And care during these times. So that's usually what my work revolves around is those 3 points and then everything that can kind of fall in between.
Yeah. Okay. That's super helpful because it kind of gives us an idea of like diving in a little bit. And so, and maybe I'm not sure if I've like compartmentalized this and because it sounds like it is not compartmentalized, right? But I kind of want to lean into both of like, okay, how, like, what's an overall, like, maybe there's four areas that you're like, okay, first I would look at this, and then I would ask this, and then I would look at this. So I don't know if that's what I'm asking, or because
Like
you're
how,
not just an herbalist, right? You're
right?
beyond that. So what does that look like? Just like a high level
Like
overview.
in practice. Yeah.
Yeah.
you know, um, because it can vary. So, and because typically I have both an in-person and a telehealth practice, right? So, in-person work is usually going to include a body work component. Usually, if I'm seeing someone in person, there's something like a pelvic floor concern, for example, like urinary leakage, right? We can keep it really simple like that. And so when I see a woman who's coming, urinary leakage, maybe she is just entered menopause. And so from my perspective, we're going to do both an assessment of her history and hormonal history, birth history for sure. When did some of this actually really start? We're going to talk about hormones and how we can support her hormones and her adrenals and these different aspects of her health now that she's in menopause and stress management. And then we'll probably do a body work assessment as well, where we're looking at her belly, her hips, her legs, maybe internal work to look at the pelvic floor function. And so from there, usually we'll put together a full plan, right, of herbal remedies potentially if that seems appropriate, dietary recommendations, lifestyle recommendations, and then usually movement or exercises or body work practices. And so women after they see me will usually almost always get a full plan like that
Mhm.
will approach the project from 3 or 4 different aspects. If I see a woman telehealth, it will basically be very similar, right? So we'll talk about what the actual concern is, what the history is, kind of see if there's, the astrology component is totally based on whoever comes to see me, right? So I have women, like we mentioned before, all walks of life. So I have women who come see me that are like, I can do 1 or 2 things. That's it. Give me the most direct, treatment plan that you can. I have some women who are like, I only want to talk about physical things, right? So we're going to focus mostly on bodywork assessment, exercise, movement, food, being really physical and grounded. And then there's another set of women who are really wanting to talk about maybe more the energetic or spiritual component of what is going on. They want to see their astrology and how it relates to the health project that they're currently in, and what kind of remedies that we can extract from their birth chart or from an astrological perspective to approach the issue. And so to determine that, right, in my practice, so I don't do like electronic bookings. So to book with me, there has to be conversation, right? So you have to like usually I require like reaching out, emailing so that we can actually chat about what's going on, what kind of service or offering is going to be most aligned with this woman, and putting together the session that way. And then, looking at intake forms and things so I can kind of get a feel for where this woman's at, how can I meet her, and how can I provide resources for her in a way that feels aligned with her and understandable and useful to her.
Yeah.
So
No, that's
yeah,
very
I know.
helpful.
And I know I'm talking way around because there's a lot that
Yeah.
can
Yeah, but
happen.
it's good. I'm learning so much about like what you do in just this world.
Yeah.
So, and I definitely want to get into the energies, but before we do that, I see you, which looks like a witch's shop. This is my vision, right? Jazmin's witch shop, where
Yeah.
you have all of these herbs and flowers, and they're like coming from the ceiling, and plants are popping out everywhere. And then you're in there with lots of like a flowy outfit on with lots of jewelry and like a space music on, and you've got books, like the ancient books open, and
Yeah.
you've got all these tinctures that you're like just putting together and all of these different medicines. So I have to know more about this. And two, I think it'd be helpful to kind of explain to others because I obviously am a big believer of herbs and various supplements, and we know they work so well without the negative impacts of medication. And so I would love to know just your kind of take on that, but then also if we have any like maybe takeaways for people listening that they're like, oh, I can do this, or oh, I can do that. I think that would be helpful too.
Yeah. So I think, one thing that I'm usually talking about with women in sessions is their experience with herbs, right? Like, have you ever taken an herbal medicine before? Do you know have you ever worked with herbs? Most people will have use tea, right? So herbal
Yeah.
tea is really common. And so we are usually having a discussion like that for comfort levels, right? So in my practice, typically teas are really common because most people are very comfortable with tea and they feel comfortable with making tea, with using tea. And then tinctures are definitely a big part of the practice, only because in tincture form, herbs will go more directly to the liver, right? Because it's in an alcohol base. So because the nature of work that I'm working with a lot of women on has to do with like pelvic hormonal liver concerns, a lot of herbs are recommended in tincture form. And so, I think my where I see women at in person is always really surprising to people, I think, when they come in to see me. I think they're not sure if they're coming into like a physical therapy appointment. Is this going to be like a clinic? And then there I am. And usually there's like very comfortable plants everywhere, books everywhere. I've got herbs and teas and different things. And then I am usually, very relaxed. I'm always barefoot. So they're going to come in. I'm going to be barefoot. They're going to take off their shoes. We're going to sit down together and either talk and have a tea, right? Or if it's virtual, being comfortable talking, having tea, whatever, and enjoying the space together. I would
I like
say,
that though. I feel like that's the new age. Like that's what I want. I know that's what like people want, that comfort and just in everything. Like even going to the dentist. Like why's it gotta be so tight in here and stuffy? Let's
oh,
make it beautiful and feel good. Yeah. So I'm a fan of that. But anyway, I'll let you
yeah.
continue.
Yeah, and I think also that's really important because sometimes, when people ask like, well, what are the tools you use as a natural health practitioner, right? And so sometimes they think, okay, body work, herbs, right? Food or dietary recommendations, different types of light therapies, hot and cold therapies, music, sound, right? And there's so many different things that can help bring our bodies and our nervous systems into more harmony that allow, right? And ultimately, that's what we're doing. And natural health is allowing the body to heal and
Mm-hmm.
move into harmony by providing, resource to the body. But one of the tools of natural health is also giving a space for people and women, especially, to actually express themselves and be heard in a real way. And even just that experience, I have found to be one of the most important parts of my practice is like letting women share their stories, letting them talk about what they feel is going on, what they already intuitively feel, which is oftentimes quite correct, that they know is happening with their body, and hearing them and believing them, right? At that, what they're saying is true, right? Because this is not the experience you get a lot. And oftentimes in a medical office, it almost feels like for women, a lot of times, like you're convincing or you're trying to convince somebody something's wrong with you and that you don't want an antidepressant or birth control or an anti-anxiety drug. Like something else is going on with your health, right?
Oh, I have a quick side note on this.
Yeah.
I was told by a man, of course, that I just needed to learn how to be a woman, that this is what being a woman is, and I needed to learn how to be a woman. And turns out then when I got all my labs done, no, my hormones were plummeted and I was experiencing all of these terrible symptoms because there was an issue there. So I just have to like applaud you for listening, because I and emphasize this point because I feel like it is so overlooked. And if we don't know any better, we just think it's true, right? If I didn't know better, I'd be like, oh, yeah, that's right. But I immediately knew that was not the case. But I'm in this world, right? Whereas many people aren't. They'd be like, oh, okay, yeah, this is just normal. So I just have to give you a shout out because, yeah, that's such a good point.
Yeah, and this is like really common, and I think maybe that's the point to give something to your audience to think about is that I always want women to know, like, you have more options. There are always options. There is always something else, right? If somebody is presenting something to you as black or white, right? This or that, you've got this choice or this choice, right? Um, it's usually not true, right? You have options. There are other resources for you out there. There's other pathways you can take. And so, the beautiful thing about herbs and natural health tools is that I typically recommend, like, call them like first and second line interventions, right? If you've got like pharmaceuticals, surgeries, this kind of thing, these are end of the line resources, right? These are end of the line tools. These are like emergency tools. These are tools when it's like, I've exhausted all options, like, let me use this level, right? It's just a different level of resource that has a lot more consequences and side effects, right? That's all. It's just a different level. But what's happened is, especially for women, is that is what has been shown to us as our only option, right? So then
Mhm.
you have a lot of women, and I see a lot of women who are like, I didn't know I had another option besides getting my uterus taken out, getting my gallbladder taken out. I didn't know I had another option besides, right, taking these pills, but it was actually my hormones were totally plummeted, and I didn't know I had other options to help me resolve that issue. And so I think I want women to know that there are first line remedies, right? Simple things when something comes up. See a natural health practitioner, right, who can help you with those first line interventions. Maybe it's simple as light breath work, body work, right? Just to help the system rebalance, right? And then there's the second line interventions, which are going to be stronger herbs, stronger medicines, more of a rigorous plan and changes in lifestyle that are going to happen, right? And then there's a lot that can happen in between a surgery or a pharmaceutical prescription, right? That women can access. And unfortunately, a lot of those options have been hidden from us, right? And so now we're unsure, or it's alternative, or woo, or whatever. But it's like, really, we have a lot of resources that have been handed down to us and that are provided to us from women along the way and before us and from the earth that can help guide us.
Yeah, I love how you frame it as like that line of options. I feel like that's really easy to like wrap around my head. And so for just to put an example on like the first
Yeah,
and the second line of defense, I'm wondering, so for example, going back to like my hormones plummeting, right? And
right.
progesterone super low. So
Yeah.
first line of defense would be something like yoga slash meditation slash breath work, like the deep breathing to help bring down cortisol to help not steal from progesterone. Would that be a correct like
Right.
first
Yeah,
level?
exactly. Something like that. If we're catching something a little bit early, it seems like, oh, something's kind of going on. My menstrual cycle is a little unpleasant. Before this, it hasn't been too big a deal, right? Or it seems like, okay, there's maybe a progesterone issue, right? It's something simple like there's very simple abdominal massage techniques to help stimulate hormone production in the ovaries, right? Stress management techniques, or what's going on that has caused maybe or been a part of this shift in your cycle, or the hormones shifting. And then yeah, definitely like simple things like meditation, mindset stuff, and then dietary things I find are often really simple, like first line kind of treatments or interventions in the beginning of things.
Yep. Okay. And then second line of defense would be, and I've seen you post this on your story before, but for example, chasteberry. So that's something that I know between first line of defense and then using chasteberry really shifted my hormones tremendously, which again, kind of like you said, first and second helped to prevent third, fourth, or fifth, where I didn't have to go on, you know, prescription progesterone because I was able to, I'm putting in air quotes, like naturally improve my own progesterone levels. So would that chasteberry be another example of a second line of defense?
Exactly. So if we saw, okay, we've kind of incorporated some of these techniques, how have your cycles been? What's been going on? Okay, do we feel like we need more support? Okay, let's look at our herbal medicine options, or things that will actually get, or we know, scientifically have an effect on increasing this hormone, right? So using something like Vitex in the system is a really good example for that. Maybe using some more liver type herbs to help decongest the liver if that seems like it's part of that. And then also I would say, even what falls kind of under that is like natural cyclical, like topical progesterone or cyclical bioidentical progesterone use
Mhm.
is also kind of coming under there, where it's like, okay, do we need more support? Do we actually need to just get straight to it and get your progesterone levels up a little bit higher, right? Especially if there's a fertility concern or something with that. So you've got kind of that line and sequence.
Yeah. Okay. This is super helpful to give those examples, but then also understand, and everyone listening understand that it's not just, okay, if you have X, it's because of Y, right?
Right.
Like when we look at the body, there's like so many things that impact each other that it's really individualized to get to that root cause and that next step. But this is just a few examples.
Yeah, just a good example, because yeah, exactly. It could be I mean, a varying amount of things for why is this project come up for this woman, right? I mean, menstrual things can vary, they can be digestive, they can be something going on actually physically in the pelvis, congestion or restriction in the fascia of the pelvis that's limiting things, scar tissue, right? Liver congestion. So you've got all these different, but I do think it's nice for people to understand or see an example is good to see like, okay, there are options along the way, and that's not even right touching the surface of all the things that we would try before it was like, you should see a doctor about this, right? But that's always there, we have to also be aware of when is it time, right, to use the medical system, right? And that's usually how I like to vocabularize. I don't think that's a word used to like, that's how I
Yeah.
like to speak about it. Like we need to if we're dabbling in the medical system, we need to use the medical system, not be getting used by it, right?
Oh, yeah. That's good. That's
That's
really
my
good.
approach with it. So how can okay, we're at that point. How do we use it, right? And we don't get used by it. And that's
Ooh.
a little bit more empowering place to be.
Yeah, I like that a lot. Okay, so if you'd like to, I would love to shift into the astrology world. And you use the word energetics a lot, which really like gives me a vibration of like, oh yes, I like that. And so can you just explain, especially for the person who maybe is like, hasn't heard of this or is like, okay, I see things out there and it like gives me a little tickle, but I
Yeah.
don't really know. I don't really know what it's all about, and I don't even know where to start. And I'll be honest, I have done a few things where I download people's like freebies that are out there, but I can't make sense of the freebie. So I'm
Uh-huh.
like, and freebie, whatever, it's like their download, right? I can't make sense of it. So I'm like, okay, well, I've got to know where to go from here because they're already beyond where I'm at. So
Right.
do you mind just kind of bridging the gap for us and kind of introducing us to this world of energies in astrology?
Yeah, yeah. So I practice a specific type of astrology that is known as medical astrology, right? So in the world of astrology, there's all kinds of different types of astrology, right? So maybe some people see astrologers for like help with their career, right? Or sometimes love is a big thing, right? Or spiritual growth or evolution. And so there's all these different types, but the type that I practice in particular is called medical astrology. And so medical astrology, I like to say, like, just straight out is definitely not like a new age type of astrology. Medical astrology is an ancient practice of medicine that's been passed down to us for a very, very, very long time. There are remnants that we see back to the ancient Egyptians who first gave us the inclination that the zodiac signs, the 12 zodiac signs, were associated with 12 different parts of the human body. And that grew through time to the ancient Greek physicians and medieval physicians and Renaissance physicians who really expanded the field of medical astrology and have passed on this gift to us in modern times. And so medical astrology is essentially, in a simple way, the association of the planets and the 12 zodiac signs with the human body and the human form. And so we see that each zodiac sign has a rulership over a specific part of the body. And the same for the planets as well, that there's a specific part of the body. And so when you look at somebody's astrological chart, right? So are you familiar with like your birth chart? Have you ever like looked at your astrology chart?
Is that similar to human design, or is
Yeah,
it
so it's
different?
been
Okay.
yeah, so it's like so what you need to pull up your astrology. So your astrology chart, each person, everyone has their own unique astrological chart, right? So what you need to look up your astrology birth chart or natal chart, you'll sometimes hear, is your birth time, birth location, and birth date, okay? And so from that, what we look at is a map of where the planets were when you were born, when you took your first breath, right? So, for example, I was born on August 7th. The sun was in Leo. So this is the most common way people know their zodiac, they call their zodiac sign, but what you're saying when you ask someone their zodiac sign is what their sun sign was. So where was the sun
Okay.
when you were born, right? So people say, I'm a Virgo, I'm a Leo, I'm a Capricorn, right? But that is only one of where one of the planets was when you were born, right? The most important one, the
Yeah.
sun, right? And so the astrological chart will show you not only where the sun was, but where the moon was, where Mercury was, where Venus was, Jupiter, Saturn, Uranus, Neptune, and Pluto. And so we get this map of the sky and we see where were the planets and in what zodiac signs were they in, and how does that correlate to your human form, the energy that you were given. It's a basically like a really cool blueprint to your health constitution, where there might be certain health weaknesses or strengths, or when you are sick or ill or something happens, what are the typical systems in your body that are going to be more sensitized, right? And so it answers and is a really interesting way of answering the questions like, why am I a woman that got endometriosis? Or why am I so susceptible to UTIs? And this woman's more susceptible to yeast infections. Or why did I have asthma when I was a kid? Right? And these unique differences and the way that things run differently in different people's bodies. And medical astrology is a framework for looking at that. I'll
Okay,
kind of
that
stop.
is the best explanation I have heard. And I'm like,
I'll
oh,
keep
that's what it
going.
is. Yeah. I mean, as an intro, I'm like, okay, got it.
Yeah.
That is so helpful. And this is really good. Okay. So I'm thinking, where can I go from here? Okay. Let's talk about how would you use this in coaching or in your practice, and obviously you focus on like the medical side of
Yeah.
it, so I'm just wondering, do you have any examples just so we can kind of like wrap our heads around of how people use this in their day to day? And then I also just have to like bring up the one of the ahas for me, which I feel like this just shows how removed we are, is that we clearly get our cycles once a month. What does the month correlate with? The moon. And it's like that. And I had that aha. One, it just showed me how far removed we are from the world, right? But then also how these energies like have such a huge impact on us
Right.
with even just the moon every month. And that's just the one that I know about, right? And so what else is there beyond that, which you just explained so well? I don't know if you have anything to add on to that, but also share some examples as well.
Yeah, definitely. And so that's one like simple way of even thinking about it, is right? Is like we see very literally the impact of the sun and the moon on our earth, right? This is what gives us seasons. This is what gives us tides. This is
Our
what influences,
circadian rhythm in our bodies.
right? And so
What is that? Yeah.
when we understand that, we see, well, like, okay, there's other planets as well, and they also have a light that they shine on Earth that causes influence. And so the cool thing with medical astrology is because there's so much time behind it and experience from so many different varieties of physicians across all of time. Not only are the zodiac signs and planets associated with different parts of our body, but also we see this classification of herbs, exercises, foods, flowers, activities that also fall under different planetary rulerships, right? So we've got herbs that are more lunar herbs or treatments for lunar or moon deficiencies, right? And we've got herbs that are solar herbs. They're like St. John's wort, right? Is this bright yellow flower. The oil is red. It blooms in June. It's a summer. It helps lift depression. It's a very solar, sunny herb, right? And so there's
Which
these
I also
classic.
have in my fridge right now.
Yes, St. John's wort is one of my it's a very special herb to me. And so that is part of what's really cool about medical astrology practice is that not only do we get an insight into your natal constitution, your root health constitution, what you were born with, but also what remedies would be most helpful to balance and bring harmony to your body and to your chart. So an example kind of following our other example with like progesterone. Okay, so progesterone is a very lunar hormone. So we would associate progesterone with the moon in medical astrology and with Venus, the planet Venus as well, right? This is a woman's hormone. This is something that shifts cyclically. It's very lunar. It's like the moon. So if a woman, for example, I've had women come for maybe fertility issues, they want me to look at the chart and see like what is contributing to the fertility project or concern that I have. Let's say this woman has her moon placement, just like she could be a Leo sun, her moon could be in a sign that's known to be like colder or drier, right? So all the zodiac signs have these energies. Some energies are hot, right? Leo is a very hot sign. It happens in the dead of summer, right? Whereas Capricorn is a very cold sign. This is like in the dead of winter, right? And so they give these energies. So let's say this woman has a moon that's in a dry or cold sign, and we would call that like an affliction. And so from seeing that, I would say, looking at the chart, hey, it looks like there will be other testimonies. I'm giving something very simple. This looks like your moon is under stress. I think you should check your progesterone levels.
Okay.
I think that's likely what's going on. She can go get her progesterone levels tested if she wants, or we can, depending on where she's at or what resources or tools she has. And then we see what the hormones look like. Easy support. Can I give an herb for that? Can I give some natural progesterone? Can she be on her way without doing all of these medical fertility treatments and the craziness that happens there, if we can just see something very simple in the chart that needs help or support in her body?
Oh, so good. Okay, so this is all like connected and clicking now. I do have one more question though, because I'm
Yeah,
seeing a
there's
lot.
a lot there.
Yeah. So I see a lot like the rising sun. Is that
Rising
the
sign?
term?
Yeah.
Rising sun.
Yeah.
And then there's another one that I hear a lot, and I want to say something moon. So the rising
Yeah.
sun, like is associated with your zodiac sign. So most of us probably have an idea what that is. But then the other one, something moon. Am I
Your moon.
making sense?
So usually people will ask your big three, which is
Okay.
going to be your sun sign, your moon sign, and your rising sign. So those are the biggest players in your constitution and your energy. So again, the sun sign is the season that you were born in, the season that the sun was in.
Okay.
The moon will be, your moon sign will be the zodiac sign. So the moon will move through every zodiac sign in 1 month. The sun moves through the zodiac in 1 year,
Yep.
right? And the sign on the rising is when you took your first breath, what zodiac sign was on the eastern horizon coming up?
Oh, okay.
That will give your physical body certain attributes, a certain look, certain things that stand out that are related to that sign. So those three are very important signs in astrology.
Okay. That is very helpful. Thank you for clearing that up.
There's
Good to know. There's so many other questions I'm
so
sure,
much.
and I'm sure people listening do too. So is there anything else that you want to cover before we wrap up and share how people can learn more from you?
Yeah. Um, so I would just say, when it comes to medical astrology, especially, there's so much. I think one of the best ways to kind of dive in is like, if you have a certain health concern, like an astrology, get a medical, specifically a medical astrological reading. They're really beautiful readings. They kind of show you this really interesting picture that will put together things like across your whole life. Or why you have certain tendencies that you do. And then I would just say for astrology, it's something that I feel like is our way to connect with nature. So astrology is often like presented as this out there, sort of far away, really out there thing. But really, especially in the practice of medical astrology, the zodiac signs are simply the earth seasons, right? So it's the 12 earth seasons following the annual cycle. It's nature based, it's earth based. And so it's very here, down to earth and practical tools for us to use, not only to help heal ourselves, but also to be in greater harmony with nature. And I know it's like you said, like there is that void I think we all feel. We're like, man, like, how did I not know that about the moon? Like, what, or why didn't I know these things? And we've been really purposely disconnected from that. And so I think it's kind of like we talked about in the beginning when we start using terminology like earth-based terms, heart-based terms, body-based terms like warm, cold, dry, hot, right? These are the terms we're going to use. In astrology, it talks to something different in us as women and something that we are innately feel connected and drawn to. And so I think it's a very special time we're in our lifetimes that we're wanting to reconnect with nature and be in more sync and cycle with nature and within our own bodies. So yes, I just want to encourage us all to keep going and keep
Yeah,
heading down.
yeah. So good. I love that wrap up too. Okay, so now everyone's like, "Oh, this is amazing. How can I learn more about Jazmin and what she does? Where can I follow along? How can I work with her?" So can you share all of that and then we'll also link it in the show notes too.
Yeah, awesome. So, my practice, my website, you can find more about me, my background, my work on my website is revolvehealing.com. And then my Instagram, so you can follow on there. I share a lot on Instagram, like where I try to like merge all of the different aspects of woman that I am, right? And so I share a lot on there, and I'll be sharing more, especially this coming year in 2025, about a lot more about medical astrology and the astrological health of women and the female pelvis. So a lot of that content will be coming out in 2025. Did I say my Instagram handle? I don't think
No.
so. Oh, it's at jasmine.cosmic.
Perfect.
And then lastly, I have something new that has just come out as well. It's kind of like a blog, a publication that I'm putting out every zodiac season that's going to break things down into each zodiac season, its rulership over which parts of the body so that people can begin to learn like during Capricorn season, like we're in now, which parts of my body are sensitized and what kind of herbs, diet, and exercise can help me to tend to this part of my body. And my goal with that is to sort of teach women or anyone who's interested in that, how if you'll follow these rhythms and seasons of Earth and which body parts are sensitized, by the end of the year, you'll have tended to every part of your health and physical body and checked in with it, learned about it, learned something new about our nature and the connection with nature. So that is that blog. I'll have that on my Instagram as well. It's going to be nourish.ghost.io. So
Okay.
I'll have that on my website, and then I'll have it linked in my Instagram as well.
Amazing. Cool. So yeah, that'll be very, yeah, I love the idea of like the full year and like full body support in the education, because I feel like that's the biggest gap I see right now, which this is what I really harp on with my field as well, as just the education. So that'll be amazing. So thank you so much for sharing all of this. It's so helpful, and I'm sure everyone's excited to follow along and learn more. And yeah, I look forward to just seeing what else we put out. So thank you so much.
Awesome. Thank you so much, Jenny. This was really amazing. I'm really happy to get to share some of this.
All right, everyone else, we'll see you on the next episode.